Here's the signs and symptoms of hydrocephalus. When we look at the basic anatomy of the central nervous system, we have the spinal cord, the brain, the ventricles in the brain, and they are all surrounded by this cerebral spinal fluid. When we take a closer look at the ventricles, we can see that the cerebral spinal fluid is building up either by an obstructive or non-obstructive cause. This causes them to enlarge and leads to an increase in ICP. When we look at the signs and symptoms that are most common in infants, there's this macrocephaly. This is defined as a head circumference greater than 2 standard deviations above the mean value for any given age or gender. Another common sign that we see is the bulging fontanelles, which are the baby's soft spots. This is caused by the increase in ICP and fluid buildup. When we do our assessment, we also want to look at the sutures because they will begin to separate first due to the increase in ICP. You may also see this frontal bossing, which is an abnormally prominent forehead with that heavy brow ridge. When you're doing your assessment, you also want to percuss the skull. It may generate a sound known as McEwen's sign that is described as a cracked pot sound. Another common sign that we see are called sunset eyes, which is when the baby's gaze is locked downwards. Something else you may see are the dilated scalp veins, which is caused by that increase in ICP. Now, something you may hear is this high-pitched shrill cry, and another sign is possibly leading to seizures. Both the high-pitched shrill cry and the seizures are late signs of hydrocephalus. Now, when we look at the common signs in children, we can see this behavioral change, including irritability and lethargy. We may also see a headache that is common upon awakening. We see this ataxia, which is the presence of abnormal or uncoordinated movements. We could see this nausea and vomiting. A common sign is any vision problems, but specifically nystagmus, which is involuntary side to side, up and down, or circular motions. And again, it can possibly lead to seizures, which is a late sign. Now, when we look at the signs and symptoms in adults, it is very similar, but it does have a few differences. We see this headache caused by the increase in ICP. Then we also see this sluggishness, decline in memory, concentration, thinking skills, and we can also see this impaired consciousness. We see this ataxia again, the abnormal movement. It can show as a shuffling gait or a lack of balance in older adults. We see this nausea and vomiting again, and in some cases you may hear of them experiencing a loss of bladder control or the frequent urge to urinate. In severe cases, we may see those seizures, and if it's left untreated, it can lead to a coma